This conversation is about you and how you make your healthcare choices. Hi, everybody. So great to be back on LinkedIn Live and other social media platforms. LinkedIn, thanks again for having me as a part of your beta test. For those of you who don't know me, my name is Michelle Berto. I'm a former television news anchor, and now I teach executives how to look good and sound good on camera. Those executives happen to be in the healthcare industry, which is why all of our conversations are geared towards what you do every single day. So we thank you for joining us if you're a part of the healthcare industry. And specifically today, we're talking about millennials and how they make their healthcare decisions. They are going to be such a big base, a customer base that we need to pay attention to as the years go on. And in that capacity, we have with us the beautiful Brianna Damaris. Brianna, thank you so much for being here.
Hi, everyone.
So, Brianna, let's tell everyone first that you are the newest intern for Berto Media Group. You just started with us on Monday. Tell us where you go to school, the degree you're pursuing, etc.
Yeah, so I am currently a senior at the University of Southern Maine up in Portland, Maine, snowy Portland, and I am studying marketing with a focus of digital marketing.
And what was it about digital marketing that you saw as an opportunity for the years to come to build a career on?
Yeah, well, I just think been a huge shift more and more to everything is not just going online, but up to on people's phones. That's where everyone's turning for everything. So that growing trend and being able to capture that market is really interesting to me.
Absolutely. And I think that you talk about growing markets, and we have to pay attention to your age bracket. Everybody has their own ideas about millennials.
Yeah.
And you do, as a generalization, you go about the world in a different way. And I think that people who are leading different industries need to pay attention to that, because you're shifting the paradigm of how business is done, especially when it comes to making your own healthcare choices.
Mm-hmm, definitely.
So what do you think is the biggest difference about how you choose your healthcare provider versus the way, for instance, your mother or I would choose a healthcare provider?
I think for me personally, and for a lot of my friends, is we're looking for convenience. You know, when I call and I'm put on a wait list for 6 months from now, that's not going to work for me. I have something I need to deal with. So when I face that issue, I turn to other platforms, like I look online or I talk to other people going through the same thing, versus waiting for that kind of primary care physician to be able to see me.
Yeah, and I think that this conversation is based off of an article that we found and we started chatting about on Forbes magazine. It came out in April, and it's still very worthy. We'll put it in the show notes. That the way that millennials choose their healthcare providers and make healthcare decisions is different, and it falls in line with 5 different categories. And I think you just touched upon one of them, and it's timeliness and access to that healthcare provider. So go a little bit more in depth about what you mean about having some digital access to a provider.
Yeah, so I think one of the biggest things is a lot of times there's a personal connection taken out of it today. You know, when you're calling and trying to get in to see someone and you're, talking to the receptionist or office administrator, and it takes it's like climbing 10 walls to get through to that doctor. So the biggest thing, if I'm able to go on their website and get, some sort of advice or some sort of other opinion to go to and steps to take in the meantime while I'm waiting to get in and actually see them, but I can still feel like I'm getting advice from them and some sort of connection from that physician, I think is really important, because otherwise I'm going to get frustrated and go to, some a walk-in clinic and be like, I just need something now. So if I can find something online from that office, I'm so much more likely to go back to them.
So that's so important, because if you are a provider and you look at your website and you say, man, this looks like it was done in 2010 and now we're in 2020, and I don't have a portal or a video series about a certain diagnosis that people can view in the meantime as they wait for the appointment, maybe that's a way that you could push forward in 2020. I'm talking to the providers now. That's one thing you could add to your list of how can I put myself out there to capture more of this audience. Yeah, that's a great point. Just having more digital access to the provider as you wait. What's another thing that you think about that maybe I would think about differently in regards to going through that appointment process and waiting that long? Because I think for me, I would wait, but I would be doing a little bit of my own research on the side.
Yeah, so I think a lot of people my age are coming in armed with an idea of what they're looking to get out of treatment, what they think their issue is, and how much they want to pay for it. I know a lot of people that have chosen to wait for certain medical services or hold off just because the not knowing the cost ahead of time can be really daunting. So they want to know what to expect before they're even walking into the door.
Yeah, cost transparency
Mm-hmm.
is something that I think that we as a society are currently trying to iron out. And I always put it in the perspective because I had gone down the road of getting a service and then getting a bill from an insurance company, and it is drastically different than what I thought I was walking into. And I
Right.
said, I remember having the conversation of, listen, when I go into the store and I want to buy a shirt and the shirt is $20, I know that I'm going to pay $20 before I take it to the register. I am doing
Definitely.
everything I can to arm myself with the information of knowing my cost and how the claim is going to be processed and the billing code. I'm calling you ahead of time. You're giving me a price, but that price is different from after the fact, after I went through the service. So
Mm-hmm.
where is the cost transparency, and who does the responsibility to be
Mm-hmm.
honest about that? Who does that fall upon?
That's such a great question. I don't know, because you think about when you're waiting for that kind of second party to step in that's not coming from your doctor. So it's frustrating that there's someone off in an office somewhere making all of these decisions that they don't know your day to day. They don't know what you're going through. So it's definitely something that I know is tough to tackle because there's so many parties involved.
Yeah, and I think that if you are a billing specialist at a healthcare provider, that and you should be a part of the conversation of what
Mm-hmm.
items could we legitimately put up on our website that are basic services that we could be upfront about the contract level that we have already discussed with the insurance providers, and here's how much it's going to cost. I understand that it is completely different under so many different circumstances. Everybody has different insurance and plans, but something that can give you, the millennial, the information that they need, because I don't think, and correct me if I'm wrong, I don't know if you'll wait on the phone with an insurance provider and go through all of the hoops that you would need to
Mm-hmm.
go through before getting a service. Am I right?
Yeah, definitely. It's not something where I want to be on hold for 3 hours just to get transferred to someone else. If there was some sort of database where I could see, okay, this is what I'm looking at for a range or a rough estimate ahead of time, even just like a virtual chat. I think so many people my age, when it comes to customer service, tend to lean towards that option. And kind of that phone call is the really like last resort, can't find anything else. So you have to wait on the line.
What do you think about doing your own research on Google? We talked about this a little bit before.
Mm-hmm.
As you're waiting for that appointment, you are going online, as am I, and going on WebMD and thinking the
Yeah,
worst, right?
right.
How does that change the way you make a decision about how quickly you would get a service?
Yeah, so when you're finding information online, obviously you have to look at the sources, but it's so easy to get kind of swirled into the, oh my God, I need to see someone right away. And then when you get into that panic, you look for the nearest option. And if I'm calling, if I can't, jump on a Skype call like we're doing right now with my healthcare provider, then I'm going to turn to kind of something like a walk-in clinic or a retail clinic where I can just get in and get out, because all of a sudden I'm in this panic because Google told me I like have 6 weeks to live. So it's something about if there was more of a convenience factor from those primary care physicians versus like, I've seen this information online, I can't get through to anyone in your office to tell me about it. So now I'm thinking the worst and going to emergency services instead.
Do you often have access to maybe going to like a CVS Minute Clinic or one of those quick counter, shall I say,
Mhm.
medical providers that you're working with, a nurse practitioner or somebody else who's going to be able to see you more immediately? Are you willing to wait a 2-hour wait at a Minute Clinic or a CVS or fill in the blank of wherever, a convenience care? Are you willing to do that versus waiting for the next appointment?
Yes, because typically when you call, for the next appointment, it's weeks versus hours. So if it's one of those things where I know I'm going to see someone today, then I'll just go and sit in the waiting room and deal with the issue like immediately.
The last thing that this article discussed is talking about making healthcare choices more holistically. Can you give us some perspective on how a millennial would go about a more holistic approach to their health?
Yeah, well, I think with one of the big things now with online, there's so many resources. So there's so many alternative ideas being put out there and we're given access to. So I think if millennials, can't get in to see a doctor or something, but now they're seeing this pop-up article about some essential oil or some like exercise routine or some steps you can take and you can get done today or wait a couple days in the mail. People are so much more likely to want to try those options because there's kind of that immediate gratification of, okay, well, I can't do that, so I'm going to do this. And then if this all kind of ties together.
Right. Now, I think that just to wrap up, I want to go over what this Forbes article said again about the 5 ways that millennials are choosing their healthcare differently. And again, it was wanting digital access, maybe getting information via Google, and so that is not necessarily the best place to make some healthcare choices, right? Cost transparency, they're orchestrating their own care in the fact that they are taking it upon themselves to make some decisions more quickly than what the healthcare paradigm puts them through. And then also thinking about their healthcare more holistically. If you had to speak directly to healthcare providers right now, what would you say to them as a voice of millennials? What would you want them to be aware of that maybe they are not up to task right now?
Yeah, I think I can sum it up in kind of 2 words is we want convenience and we want connection. So I want access to you and I want it easily. And those are kind of, think, the 2 biggest frustrations a lot of us are facing.
I love that soundbite. We'll be teasing that, won't we, Brianna? We'll be pulling that from this conversation. No, that's a great way to explain it. And I think just to wrap up these ideas so that you have some action items, because, Brianna, I love my action items.
Oh, yeah.
It's just the idea that if you are in a space where you're feeling as if you want to impact more people and you really want to grasp onto the millennials that are out there and that are going to be making up more of the population, that you need to do a self-audit of sorts of what does my website look like? Do I have a portal online in order to make an appointment for someone to see me? Is that easy? Is that convenient? Is it accessible? Is there a way that I could challenge myself to have some cost transparency of basic services that we offer? And what can I do to immediately talk to the prospective patient versus having them go somewhere else, a competitor, or to simply start treating themselves, which may not be the best choice because of all the information that is out there. So those are some go-to questions that you could take out a journal, however you jot down your ideas, and go through those top 5 and truly put pen to paper and answer those to see what you could do better, and then you could use that information to make some changes in the beginning of 2020. Brianna, great thoughts. Do you have any last words for the healthcare providers out there or for your peer millennials?
Yeah, I think convenience and connection, that's like what we're dying to get, is we want it now.
Brianna, thank you so much. I'm so happy that you are now a part of the Birdo Media Group team.
Thank you.
Super excited to have you on board, and I feel blessed to be able to learn from you, and I hope the feeling is likewise.
Definitely. I'm really looking forward to this coming journey.
All right, Brianna, thank you so much to everybody who is on Facebook Live or LinkedIn Live or YouTube Live. It's been a pleasure talking with you, and I always want to hear your comments on things that we can do better, things that you want to hear about. You could always reach me at michelleberto.com. Until next week, everybody, we'll be back. And our guest next week is a great guy. He is a web designer who is working with those in the healthcare industry. And he's actually going to walk us through what a good website is, to talk about what Brianna was discussing about having a portal, having a chat available so that people can have immediate access to you, to have safe conversations so that we are still in line with HIPAA, but we are still reaching the people that we need to reach and help them. All right, everybody, have a great Friday. Happy Friday. Enjoy your weekend. Thanks, Brianna.
Thanks, Michelle.